California has become the first state in the union to give health insurance to illegal immigrants. Under the new policy, all illegal immigrants will qualify for California's version of the federal Medicaid program, Medi-Cal. Previously, those in the country illegally were barred from receiving full coverage, save for emergency and pregnancy-related aid under certain conditions. Now, the move is expected to give around 700,000 illegal immigrants between 26 and 49 eligibility for full coverage.
While California expands access to care for undocumented immigrants, New York appears to be taking a more aggressive stance. Per the World Socialist website, New York City, at the behest of Democratic Mayor Eric Adams, will evict 3,500 migrant families from city-run homeless shelters in January. Adams issued an executive order in October that limited stays for migrant families to 60 days before they must leave the shelter system and reapply, with no guarantees that a place will be found for them. Single adults are limited to a 30-day stay before they must leave and reapply for housing. The move comes as Adams instituted a number of new policies designed to curb the impact of ongoing busloads of undocumented migrants getting moved from states like Texas into blue states. Here's Adams late last year.
To better coordinate these arrivals today, I'm announcing an executive order requiring charter buses transporting migrants, those often contracted by the state of Texas, to provide 32-hour notice in advance of their arrival into New York City. To make sure we have sufficient staffing, we are also requiring that these charter buses arrive only between 8:30 a.m. and 12 p.m., Monday through Friday, and to only drop off passengers at one spot unless directed otherwise by New York City Emergency Management.
Here to discuss the ongoing situation at the southern border and how various states and governors are handling this issue is Daily Caller immigration reporter Jennie Taer. Jennie, welcome back to Rising. Thanks for joining us.
Thanks for having me.
So how is this decision to extend coverage to illegal immigrants being received in the state?
You know, I think one of the biggest impacts here is this pull factor that migrants that cross the southern border and even the northern border, they tend to go to states that offer a lot of public resources like healthcare. So in this situation, one of the things that I think we will see is that more will come to states like California, especially because crossing the border there is a lot easier than, let's say, in places like Texas, where we're seeing the governor there crack down on illegal crossings and allow his state authorities to go after it. I think that that has a big impact, and maybe some of the traffic going through Texas will be pushed through California by the cartels, and then we'll see a further explosion in addition to the 700,000 illegal immigrants that are going to be added to the healthcare coverage as the state, has a burden right now of a growing budget deficit. They're taking on even more of these expenses due to this program.
A poll from 2021, it's the most recent one I could find, showed that 66% of California adults supported health care coverage for undocumented immigrants. Already, health care coverage, access to Medicaid was offered to children, undocumented children in the state, presumably with the belief that it would be unethical and wrong for children to be dying of preventable diseases in the street in one of the richest states in the richest country in the world. And another point that's been made in the context of this conversation is how expensive emergency care visits are, which ultimately get subsidized by the public anyway, when people ultimately get very sick after not going to the doctor and use the emergency room, undocumented people using the emergency room, like so many poor Americans do, as their primary source to get medical care. Have you looked, Jennie, at all into the cost-benefit ratios of going ahead and extending health care to this population as opposed to the informal subsidization that's already going on between all poor people, but in particular these undocumented people and the general public?
Yeah, I think that states like California, for example, had their deficit, it was just 14 billion in June and then jumped now to 56 billion. And so the addition on that from services like this will certainly have an impact. But I think also you see this a lot at the southern border with small underfunded counties having to shoulder these hospital bills, especially when you have people crossing in really inhospitable conditions, right? The heat, the elements, things like that. People having to get really quick emergency care and services. There's a hospital actually in Yuma, Arizona that has unpaid bills that they're trying to get reimbursed by the federal government because they had to shoulder the burden of millions of dollars for helping these migrants that crossed into that area as well.
Well, I mean, that seems like we're in a situation where we get sort of the worst of both worlds from a from an accountability perspective. Wouldn't we want, given their illegal status is an issue, because I want immigrants working and then paying the same in taxes as their neighbors, as anyone else, paying into the social safety net, and then obviously deriving the same benefits that anyone else would get. But because they're illegal and have to make income illicitly without reporting it, again, of course, this is being done to them by the government not giving them that legal status. So is that difficulty explored here?
Well, I think that's exactly what Eric Adams and these Democratic mayors are asking the Biden administration for, is for expedited work permits. And the Biden administration has been pretty silent on that. You have to wait about 6 months after crossing illegally to actually obtain a permit to apply for it. So you can imagine that that is what creates the burden in a lot of cases, especially in New York City, where now they're having to, one, restrict buses arriving from Texas, and then two, kick people out of shelters. And then another thing Eric Adams has been doing is trying to, quote, re-ticket migrants to other areas of the country.
One report by KFF showed that immigrants have lower health care expenditures than their U.S.-born counterparts as a result of lower healthcare access and use, although their out-of-pocket payments tend to be higher due to high uninsurance rates. And research shows that because immigrants, especially undocumented immigrants, have lower healthcare use, despite contributing billions of dollars in insurance premiums and taxes, they help subsidize the U.S. healthcare system and offset the costs of care incurred by U.S.-born citizens. What alternatives, Jennie, are there to providing health care for people who are living in this country, pregnant women, children, and the like, without having people dying in the street while they await the outcome of their immigration proceedings and the like, then to extend health care to them the same way that so many peer nations in Europe have a universal health care system, which would extend health care to either of us if we happen to be in, say, Sweden and break our arm?
Right. I think that it's going to continue to actually burden the system more because, as we see, like states with huge deficits are adding this to their budget. So that's something that at least the Republicans in the state government in California have warned about for years, because this didn't just start in January when this came into place. This started in 2015 when they began adding children to this program, and then now they're upping that and adding, all adults here. So this is something that has progressively been happening as the state continues to spend more than it can, provide. And so that's the concern from kind of the Republican wing of the state there.
Jennie, I do want to get a responsive answer, though, to the question, what's the alternative in light of the fact that there are these millions of people in the country without health care, pregnant women, children, and the like? Do Republicans have a plan to deal with the humanitarian implications of having millions of people living here who don't have access to health care and who rely on emergency care for their primary health care at the cost of American citizens in a backhanded and more expensive way?
Sure. I think that's a big question, especially coming up in 2024. You have people like Donald Trump saying that they're going to carry out the largest deportation in history. But again, we really don't have clarification on some of these key elements of, well, how are you going to do that if you have to wait till 2031 for someone's court date, right, to fully adjudicate cases? And of course, how can you care for them within the time they're here when it comes to healthcare, like you said, and education and all these other things? I think that is definitely a big concern that I don't think Republicans have really met with much, policy proposals at this point. I think the conversation has been more surrounding about closing down the border, in their words, and carrying out mass deportations.
Right. Something that there are deportations taking place, not keeping up with the influx we have. So it doesn't, it strikes me as something, a game that's talked about but not lived up to, when really what we need is some way to to resolve the legal statuses so that people getting benefits can be contributing to the social safety net and it be fair to everyone, and then have some process for people to come in legally so that we don't have the dangerous, unexpected rushing and flooding of the border that everyone seems so upset by. But that would take, fortunately, bipartisan work in Congress that we're unlikely to see. Jennie Taer, thank you so much for joining us.
Thank you.